Hi, my name is Chris Dunham. I'm 46 years old. I've had back problems since probably 1999. That's when I had my first MRI. It's lower back. I had surgery about 10 years ago, and I looked for a neurosurgeon back then because that's what everybody said you need to have a neurosurgeon do it. And it never felt right after that. I've had problems for the last 10 years. I always like to be active and play with my kids, and it got to the point where I couldn't do that. I have had 14 epidural injections. I've had several trigger point injections over the years. A pain management guy, which I saw quite a bit. And I had a really bad problem around June of 2015. And I just got so bad, I had sciatic pain down my right side. I couldn't walk very well at all. I was taking lots of Vicodin and lots of Advil every day. And it just got to the point where I knew, because of the pain down my leg, into my hip, my leg, my shin, my foot, that I needed to have surgery. And I didn't want to see a neurosurgeon again. I wanted to go to an orthopedic doctor that specialized in back. So I looked around. I live in the city of Orange. I looked around. My first surgery was here at Hoag. And I didn't want to go to Orange. I didn't find any doctors that I really liked. So I did a lot of research, did a lot of due diligence, and found Dr. Peters. And saw that he had come from Colorado, that he had worked on several athletes. And he looked like a great guy. And I came and met with him, and we talked for a while. And he took the time to sit with me, asked me lots of questions, looked at my MRIs. And we decided that I needed surgery. The first time I had surgery was in 2005, and I did everything I could from 1999 to 2005 to not have surgery. I tried therapy, I tried chiropractors, everything I could think of to not have surgery. So I had it in 2005. Again, never really, it didn't work, and I know that because I can compare it to now from what Dr. Peters has done for me. The last 6 months is night and day compared to the 6 months post-operation in 2005. I don't know what he did exactly. I did have a minimally invasive micro discectomy at L3 and L4. The first surgery was L4, L5, so this was the one right above it. And he went in there, and I was in the hospital for a day. I went home the next day, and they got you up and walking around within an hour. I felt relief right away. And it's just taken about 3 or 4 months to progressively get better. Started doing physical therapy. I did some aquatic therapy, some traditional therapy with massage. And right around Christmas time, so this was August 31st was my surgery. I had right around Christmas time, I was able to go on a hike. I've been throwing the football around with a buddy of mine. I've got back in the gym the last couple of weeks. Obviously trying to lose weight, that's going to be a big thing for me, but I feel like I've got my life back. I'm playing with my kids. I'm doing so much more around the house. And, Dr. Peters, I have a hard time not giving him a hug every time I come in here because I love the guy. He's just a great guy. And on their website, they talk about VIP treatment, and it is so true. Every time I come in here, he treats me like he sits down in the office, sits down in the room with me, talks to me, asks me how things are going. He's not in a hurry to get away from you. And Kaylee, his assistant up in the front, has been phenomenal. I called probably more than I should have right after the surgery if I had some pain or had some questions. And sometimes Dr. Peters would get on the phone. I don't know if he's going to do that for everybody, but on occasion he would get on the phone with me and talk to me and let me know what I should do. And I just can't say enough about this office. I've told many people about Dr. Peters. He's a great guy. Kaylee is phenomenal. She takes great care of you, and hopefully I'll never have to have back surgery again, but if I do, Dr. Peters is my guy. It's phenomenal.